Hi, my name is Stepheny Garcia.
My name is Robert Kurtz, and today we're going to be talking about norovirus. Norovirus is a highly contagious virus that causes gastroenteritis, an inflammation of the stomach and intestines, leading to symptoms like vomiting, diarrhea, stomach cramps, and nausea. It spreads throughout contact with infected people, contaminated food or water, and surfaces. The virus has an incubation period of 12 to 48 hours and typically lasts 1 to 3 days. Common outbreak settings include healthcare facilities, schools, cruise ships, and restaurants. Preventing norovirus involves hand washing, disinfecting surfaces, and avoiding contaminated food or water. It causes numerous gastroenteritis outbreaks worldwide, impacting public health, especially in vulnerable populations.
Norovirus is highly contagious virus that causes gastrointestinal illness with symptoms like vomiting, diarrhea, stomach cramps, and nausea. It spreads person to person through contaminated food or water and via surfaces. The incubation period is 12 to 48 hours, and outbreaks are common in healthcare facilities, schools, cruise ships, and restaurants. Illness usually lasts 1 to 3 days. In urban areas, 29% of households with more than two people are affected, compared to 7.3 in rural areas. Preventing the virus involves proper hand washing, disinfecting services, and avoiding contaminated food or water.
Norovirus is a highly contagious single-strand RNA virus from the Calliciviridae family. It causes gastroenteritis with symptoms like vomiting, diarrhea, and stomach cramps. There are at least five major groups, with genogroup 2 being the most common in humans. Multiple strains contribute to recurring outbreaks, and the virus is highly resilient, surviving on surfaces for days, even in harsh conditions. This resistance makes it easy to spread in crowded places like schools, healthcare facilities, and cruise ships. Preventing transmission relies on proper hygiene and surface disinfection, monitoring food and water sources for contamination.
Norovirus belongs to the Calliciviridae family and the norovirus genus, responsible for most viral gastroenteritis outbreaks in humans. It's a small, non-enveloped, single-strand RNA virus, about 27 to 40 nanometers in diameter. Its genome is positive sense RNA, allowing for rapid replication. The virus has a high mutation rate, leading to genetic diversity and recurrent outbreaks. Unlike enveloped viruses, its lack of lipid envelope makes it highly stable and resilient, allowing it to persist on surfaces. The resilience and genetic variability contributes to its widespread transmission and reinfectious.
Norovirus is an infectious disease that spreads easily through person-to-person contact, contaminated food or water, and surfaces. It's very contagious, with just a small amount of the virus able to cause illness. Outbreaks often occur in closed environments like healthcare facilities, schools, and cruise ships. The incubation period is 12 to 48 hours, and people are contagious from the onset of symptoms to at least 3 days after recovery. Its ability to spread quickly and persist on surfaces makes it a significant public health concern.
Norovirus enters the body through the mouth, typically by ingested contaminated food, water, or surfaces. It exits through feces and vomit, which are highly contagious. Proper hygiene, like hand washing after contact with contaminated surfaces or bodily fluids, is crucial to preventing its spread.
The primary reservoir for norovirus is infected humans who shed this virus through stool and vomit. It spreads through direct contact, contaminated food, water, and surfaces. There's no known animal reservoir for human infection. Asymptomatic carriers can also spread the virus, making hygiene and sanitation crucial for preventing outbreaks.
Norovirus spreads primarily through person to person contact, contaminated food or water, and surfaces. Even small amounts of the virus can cause infection. It can be transmitted when infected individuals touch surfaces or prepared food, and the virus can survive on surfaces for days. People remain contagious from the onset of symptoms to 3 days after recovery, making it highly transmissible, especially in crowded settings like healthcare facilities and schools.
Norovirus causes rapid gastrointestinal symptoms, usually within 12 to 48 hours of exposure. Common symptoms include vomiting, diarrhea, stomach cramps, and nausea. These typically last 1 to 3 days, though fatigue may persist. While most cases resolve without medical intervention, severe cases, especially in young children, the elderly, or those with weakened immune systems, can lead to dehydration. Symptoms of dehydration include dry mouth, dizziness, and weakness, requiring medical attention and rehydration in severe cases.
To diagnose norovirus, it's important to assess recent exposure, such as contact with infected individuals or travel to areas with outbreak, like cruise ships or healthcare facilities. Patients often present with sudden onset of gastrointestinal symptoms such as diarrhea, vomiting, and stomach cramps, typically 12 to 48 hours after exposure. High risk settings like school, restaurants, and healthcare facilities are common sources of outbreak, and epidemical history linking symptoms to recent outbreaks can help confirm a norovirus diagnosis.
The gold standard for diagnosing norovirus is RT-PCR, which detects viral RNA in stool, vomit, or environmental samples, providing high sensitivity and specificity. Other rapid tests include enzyme immunoassays and immunochromatographic assays, which detect antigens but are less sensitive. RT-PCR results take a few hours, while rapid tests provide results in 30 minutes to an hour, though they may have a higher rate of false negatives, especially with low viral loads.
Norovirus is a highly contagious, non-enveloped, single-strand RNA virus. Unlike rotavirus and astrovirus, norovirus is more resilient, able to survive its harsh environments and can lead to outbreaks in places like healthcare facilities and schools. Its genetic diversity makes long-term immunity challenging, and it spreads easily through contaminated food, water, or surfaces, leading to rapid transmission in crowded settings.
Norovirus is common in settings like healthcare facilities, schools, and cruise ships, and restaurants, especially where people are in close contact. It is more frequent in winter months, but can occur year-round. Though endemic worldwide, norovirus causes periodic outbreaks, especially in high-risk environments. While it can lead to localized epidemics, it doesn't typically cause global pandemics.
To prevent norovirus from becoming a pandemic, focuses on good hygiene practices like frequent hand washing and disinfecting surfaces, ensure food safety, especially with shellfish, and maintain safe food handling. In outbreaks, implement rapid response, including isolation and quarantine measures. Public awareness and education on symptoms, prevention, and when to seek care are crucial to limit spread.
To prevent norovirus, practice frequent hand washing, disinfect surfaces, and ensure safe food handling. There's no specific antiviral treatment, so care focuses on hydration to prevent dehydration. Oral rehydration solutions are key. Currently, no vaccine is available, but research is ongoing with promising candidates in clinical trials. These vaccines aim to reduce the severity or likelihood of infection by targeting common strains of the virus.
Worldwide, norovirus causes 1 in 5 causes of acute gastroenteritis leading to diarrhea and vomiting. It affects 685 million people annually, including 200 million children under 5, causing 50,000 deaths. The virus caused 60 billion globally due to healthcare expenses and lost productivity. It is the leading cause of gastroenteritis outbreaks worldwide.
Norovirus is the leading cause of vomiting and diarrhea in the United States, causing about 2,500 outbreaks annually, leads to 900 deaths, 109,000 hospitalizations, and 465,000 emergency visits, primarily among older adults and young children. The economic impact is about $2 billion each year due to lost productivity and healthcare costs.
Norovirus outbreaks in the San Francisco Bay Area have significant economic and community impacts. Healthcare costs rise due to increased treatment and sanitation needs. The tourism and hospitality industries, particularly cruise ships, suffer losses from cancellation and reduced booking. Local businesses face absenteeism and disruptions. Healthcare facilities experience strain during large outbreaks, leading to staffing shortages. Public health response costs include education and contaminated efforts. Social disruption occur in schools, workplace, and community centers, especially affected vulnerable populations like the elderly.
The San Francisco Bay Area should monitor norovirus due to its highly contagious nature and the potential impact on vulnerable populations like the elderly and children. Outbreaks can disrupt public health and the economy, especially in healthcare, tourism, and local businesses. Monitoring helps with rapid outbreak detection, response, and prevention efforts, minimizing further spread and economic disruption. While the illness is usually self-limiting in healthy adults, its ability to spread quickly in crowded settings makes ongoing monitoring crucial to protect at-risk groups and mitigate broader impacts.
In summary, norovirus is a highly contagious virus causing gastroenteritis, primarily spread through contaminated food, water, or surfaces. It leads to significant healthcare loss, absenteeism, and tourism losses, especially in healthcare. Schools and cruise ships prevention focuses on hand hygiene, surface disinfection, and safe food handling, while treatment is supportive care such as rehydration through no vaccine is available. Research is ongoing. Ongoing monitoring is essential for quick outbreak detection and response, especially for vulnerable populations. While usually self-limiting in healthy individuals, norovirus can cause significant disruption in both public health and the economy. Thank you.
Thank you. We look forward to your questions and hopefully being able to provide great answers.